is the technical manager of the dairy portfolio of Zoetis. I call her a dairy specialist, but she will introduce herself to you. And thank you very much for your time and your willingness to share your knowledge on the dry cow remedies. It's much appreciated. Thank you.
Thank you, Helena, and thank you for the introduction. If my sound starts waning at any time, just let me know and then I'll put the video off. But yeah, thank you so much for asking us to present at the Dairy School. It is an honor for us to present alongside some of the people that I regard as legends in the dairy industry. And at Zoetis, we are very passionate about the dairy industry. We really want to help our veterinarians and our farmers and all the role players to really farm to the best of their ability. And so anything that we can do to help in that regard, we really try and do. So like Helena said, I am one of the technical managers on the ruminant side at Zoetis, and I am responsible for the dairy, sheep and reproduction portfolios. So what I am going to speak to you about today is the dry period in the cow, because it is really an important period. And even though it is easy to think of it as the end of lactation, what it rather is it's starting to prepare that animal for the next lactation. And what you do in the current dry period will have a lot of effects and consequences for the next lactation that is coming up. Okay, so let's look at what happens as soon as lactation stops. Firstly, what happens is obviously the milking is stopped. The alveolar cells are initially engorged because milk is still being produced. So there's an increase in pressure in that udder, right? This is eventually resorbed back, okay? What is important is during the dry period, the milk producing cells that have been damaged during the lactation need to be replaced by cell turnover. They need to be renewed. And not just that, but new secretory cells need to be formed as well. And that is very, very important, because if there is sufficient time for new secretory cells to be formed, that would mean obviously there are more cells to secrete milk in the next lactation. And that is why the dry period is critical for that maximum milk secretion. So in general, we can divide the dry period into 3 phases. And the first phase is right after you've dried her off. So in other words, just after lactation has stopped. And that is when involution of that udder starts occurring. This is also one of the high-risk periods for intramammary infections and chemical mastitis. And here the udder is more susceptible to infection for a variety of reasons. Like I said previously, that milk flow is stopped abruptly. That means there's no more flushing of bacteria, there's increased pressure in that udder, and that obviously also has a physical effect on the teat canal in terms of dilating the teat canal and causing an entryway for bacteria to go into that teat canal. The middle part of the dry period is your lower risk period, and this is when they call it a steady state of involution has taken place. So this is where the udder is regarded as relatively resistant to infection. There are protective factors such as lactoferrin present that can bind iron. The teat canal is also hopefully closed by that keratin plug that Dr. Inga-Marie Petzer has also referred to in her presentation. And then when you look at towards the end of the dry period is also once again, when it becomes more of a higher risk for intramammary infections. This is also where colostrogenesis takes place, in other words, where the colostrum is starting to form. And here, because of the fact that those protective factors in the udder start declining, like your lactoferrin, etc., starts declining, the keratin plug that was there starts to break down, and depending on how long the dry period is and depending on the antibiotic that was used, it might be that the levels of the antibiotic might start falling below the minimum inhibitory concentration needed. So it might start falling below the MIC towards the end of the dry period. Okay. One thing that is important to know is that new intramammary infections that are acquired during that dry period can actually remain silent until she coughs. So a lot of the mastitis cases that we see in early lactation were actually acquired in the dry period. Obviously, the causative pathogens differ from farm to farm. It depends from season to season or year to year, even on the same farm. And these are all important when you are considering the control strategy for that specific farm. Okay, so this is just to show you once again, the red line is your high risk periods when it comes to your new intramammary infections or your mastitis cases. So you'll see in the early and late dry period is especially when you see higher risks for new intramammary infections. All right, so this was also taken from a study by Bradley and Green. And here you'll see, so this is the months in lactation from month 1, and then the incidence per 100 cows. And you'll see the pinkish red there, those infections were that you see them in the first month in lactation, but they were actually acquired in the dry period. And the blue section is the infection was acquired then and in the lactation period. And what you'll notice in the first 2 months especially is that that red pinkish block is actually quite big relative to the blue block, and it becomes smaller and smaller as lactation carries on. In other words, the infections acquired during the dry period, those are the ones that you see actually then manifest themselves in that first month or 2 or even 3. And I mean, you can see the red line actually, even though it's small, it actually goes up to the 8th month of that lactation. So that just further emphasizes the importance of good dry cow management. All right, so you are, as students, you are probably very comfortable with gram staining at the moment, or what it means. So gram positive versus gram negative. And so for those who maybe aren't as comfortable, just to give you a brief overview, is that the gram stain is a special staining technique that they use in a lab. And this can then be used to differentiate between the different bacteria based on the properties of their cell wall. And so after staining, the gram-positive bacteria will appear a bluish purple and the gram-negative a reddish pink. Okay, so just to show you some photos. Okay, so I'm not going to spend a lot of time here. Dr. Inge-Marie Petzer did also spend time on the different bacteria and which are contagious and which are environmental. But just so that you have a refresher on which are your gram-positive bacteria and which are your gram-negative bacteria. And you will notice that a lot of your gram-negative bacteria are also your environmental bacteria. However, you can see that on the gram-positive side, there is your bacteria like your strep uberis that also form, and your strep dysgalactia that also form part of your environmental bacteria. There are some of these that do fall into both categories, but just as a general differentiation, you can see here how they generally divide these bacteria into the different groups in terms of contagious and environmental. And then just a brief recap on what it means when we say contagious mastitis versus an environmental mastitis. So the contagious mastitis are those organisms that can live on the cow skin, they stick to that mammary tissue, and they are spread from one cow to the next through the milking machine or equipment that is being used, dirty towels, hands of the milking attendant, etc. Your environmental bacteria are usually your opportunists that live in the cow's environment, very difficult to eliminate because of that. And here, a lot of these infections occur when the cow's immunity is a bit weaker, so especially those high-risk periods that we were talking about, or when like Dr. Inga-Marie has also mentioned, when the management is so good and they have actually taken care of the contagious mastitis or contagious pathogens so well, we see that those herds are often more prone to developing an environmental or clinical mastitis because of that. Contaminated teat ends, and then a big thing is also the absence of the keratin plug. So I'll be speaking about that keratin plug and what causes it not to form a little bit later. But obviously, if there's no keratin plug, it means that there's a highway for that infection to actually enter through that open teat canal throughout the dry period or until it closes. Okay, and this is also very basic. Obviously, as you know, these pathogens don't read the textbooks, but this is just a general differentiation between contagious mastitis and your environmental mastitis. You usually, initially, don't see a large elevation in your somatic cell counts, but you do see a clinical mastitis with abnormal milk, swelling, redness, heat, and this can happen very, very, very fast. With your contagious mastitis, more often than not, you have a subclinical mastitis initially with quite a high elevation in the somatic cell count. Okay, so when we look at the dry cow, we can generally divide I call it the mastitis decision tree, into 4 options. So either no treatment, which no one is doing, then just antibiotic dry cow therapy, which most of our farmers are doing at the moment. And in general, most of our farmers are practicing blanket antibiotic dry cow therapy. Then you can select cows that are eligible to just receive an internal teat sealant, which I'll be telling you a bit more about later in the presentation, or combination antibiotic, combination dry cow therapy, which is basically a combination of an antibiotic and an internal teat sealant. All right, so when I say blanket antibiotic dry cow therapy, I mean that every dry cow receives antibiotics, regardless of whether she's had a history of mastitis or not, regardless of anything. They just, in Afrikaans, we just say voedie voed, they just all receive antibiotics when they dried off as a standard. Selective dry cow therapy, which is more practiced in overseas countries because they are more strict with antibiotic use. There, they need to be a little bit more prudent with their antibiotic use. And there they go down to cow level and they actually look at what each specific cow needs based on her history. But we'll be chatting about that a little bit more later as well. So just so that you know what the difference is between an antibiotic dry cow therapy and an internal teat sealant. So your antibiotic dry cow therapy can be used to treat an existing mastitis. It is an antibiotic, obviously. most likely there's a milk withdrawal, and then it most likely can have an effect on the herd somatic cell count by sorting out that bacteria. An internal teat sealant is not an antibiotic. It does not have any antibiotic properties, and it is basically exactly what it says. It just seals that teat canal. Okay, so what it does is it tries to seal that teat canal so that there can no longer be any ascending infections from the environment into that teat canal in case a keratin plug has not formed. So because of the fact that it's quite an inert substance, it will not have a direct effect on the somatic cell count. However, because of its effect in protecting that udder from your environmental pathogens, it can have an indirect effect. All right, so looking at antibiotic dry cow therapy. So this is usually in the form of a tube, and it is administered to the udder via the teat canal, in other words, intramammary, at the beginning of the dry period, immediately after the last milking. Okay, so ideally, the animals should be tapered in terms of their feed intake so that they are dried off when they are producing around 10 to 15 liters per milking. However, I know that a lot of farmers don't do that, and that the animals are just milked off abruptly while they are still producing quite a lot of milk. The thing with antibiotic dry cow therapy is that they are designed to have very long acting effect, depending on the product that you use. And so the reason for that is that they can penetrate the deeper tissues and increase the chances of curing any existing infections that there might be. However, because of that formulation and because of that long period of action, it usually also has a longer withdrawal period. And so this is very, very important that farmers do not confuse their dry cow therapy with their lactating cow therapy, because if that happens, it is quite a disaster in that this milk then would need to be, if they are treating a lactating cow with a dry cow remedy by mistake, that milk will have to be thrown away or discarded for the milk withdrawal period of that dry cow therapy, which can be quite long. Okay, so like I've mentioned before, there is increasing concern over the use of antibiotics in food-producing animals. Overseas, I think they are feeling the heat a lot more than we are in South Africa at the moment, but I want to predict that it will come this way as well. But overseas, they actually need to really prove why they used an antibiotic. And I think as veterinarians, it is part of our responsibility to already start the prudent use of antibiotics and to develop a strategic and a focused approach to the use of antibiotics in general, but also in our dry cow therapy. Okay, so when we look at new infections that can occur in the dry period, there are a few factors that can influence that animal's susceptibility to developing new intramammary infections. One of these is the keratin plug that we've mentioned before, and the fact is that it creates that physical barrier. There are substances in that keratin plug that can also inhibit bacterial growth, and it is made by the cells lining the teat canal. And as I've mentioned before, if that keratin plug does not form, that teat canal is completely vulnerable to infection. All right, so one New Zealand study showed that approximately 50% of the teats were still open at 10 days after drying off. And 5% of teats were still open 60 days after drying off. So in general, a farmer will have a dry period of between 40 and 60 days. So if you think that 5% of those teats were still open 60 days after drying off, that means that for 5% of the herd, that their teat canals were open for the entire dry period. Another study showed that especially in your high-producing animals, they formed keratin plugs much slower, and 23.4% of the teats were still open after 6 weeks. So that is also almost your entire dry period that those teat canals remained open and vulnerable to infections. They also showed that udders with closed teat canals were 1.8, so almost twice less likely to develop a new infection during the dry period, just because of the fact that, if that teat canal is sealed, that it protects that udder from environmental pathogens entering through that open teat canal in the dry period. Okay, so when we talk about internal teat sealants, it's made of a substance called bismuth subnitrate. And it's a paste, it's almost a silicone-like consistency. It sinks to the lower part of the teat canal and it remains there. It doesn't harden or set, and it remains there for the entire dry period until it is removed either by manual stripping by hand or suckling by the calf. And there's no adverse effects to the calf when it is suckled by out by the calf. And so what is important here is that it's not like your bathroom silicone that you use, it sets and hardens. This just stays there. It's been shown to stay there until it's milked out, and it just forms that physical barrier to prevent bacteria from entering and causing an infection. So basically what it does is it mimics that keratin plug. Okay, so like I've mentioned before, it's an inert substance. In other words, it does not contain any antibiotic. So it can't kill or cure an infection that is already in the udder. And because of that, it is very, very important that it be administered hygienically. So usually what we would recommend is that you first insert the antibiotic, the intramammary antibiotic, and then followed by the internal teat sealant. Very important that the teat canal is actually pinched at the top and the internal teat sealant is then inserted. However, it should never be massaged up into the udder. It should just be put into that teat canal, into the end of that teat canal, and that is where it will stay and for the entire dry period. It does not set or harden. Okay, so, and because of the fact that you can just think for yourself, you're now closing that teat canal and you're closing up that udder. It is very important to select the cows that you are going to be treating with an internal teat sealant only by her records, and any animals with suspected mastitis should not be treated with an internal teat sealant only, because you are basically closing up that udder. Also, very important is that this internal teat sealant, but actually with any intramammary preparation that you are putting into the udder, that it be put in, that it be administered as hygienically as possible. I almost want to say with surgical cleanliness, because of, if you can just think, we also have narrow spectrum antibiotics on the market like Fortitude that I'll be sharing with you a little bit later. And so if you are, while you are administering this intramammary antibiotic, which is a narrow spectrum, if you are introducing a gram-negative bacteria into that teat canal while you are administering this narrow spectrum antibiotic that is just effective against gram-positive bacteria, you might be iatrogenically causing problems in that herd. Okay. Okay, so this is what I've been saying. It can protect the quarter from new infections during the dry period, especially in cows with open teat canals. And it can also extend the period of protection. So like I said earlier, remember the antibiotic levels start waning towards the end of the dry period. And so if you use an internal teat sealant together with an antibiotic dry cow therapy, especially in your animals with a longer dry cow period, then at least that udder is still protected towards the end of the dry period. Just to show you here, if your dry period is extended, and your dry cow therapy perhaps only works till a certain stage before the levels start falling, but your internal teat sealant stays there until it is milked out. Okay, we don't recommend that it be taken out with the milk machine just because of the fact that it can actually block the filters in the milk machine, and then it can also have an effect on the milk quality, and also the more in terms of when, for example, they use the milk to make things like cheese, etc. Okay, so in general, you just don't want it in the milking machine. Okay, so I'd like to introduce you to the Zoetis solutions for dry cow therapy that we have. We like to call it the triple strength approach. So boost, treat, and prevent. And what we have there is our EnviroCore J5, which is a vaccine. And then we have Fortitude, which is our narrow spectrum cloxacillin dry cow therapy, antibiotic dry cow therapy. And then we have Orseal, which is currently, as far as I know, the only internal teat sealant available in South Africa. Okay, so just to quickly chat to you about EnviroCore J5. Like I said, it is a vaccine, and it is registered to help aid in the prevention of your E. coli mastitis cases, right? So it's a 3-dose regime. It's 5 ml doses. And your first one you give at dry off. The second one at about day 30 into the dry period. And then your third one at plus minus 49 days, so at calving or up to 2 weeks after calving. And important to note that this vaccination program that's here on the screen needs to be repeated annually. So it's a 3-dose regime, and every year they need to get these 3 doses. Okay, so like I said to you, important to read package inserts. This is not a prevention. This is an aid in prevention. And so you might still see E. coli cases. However, what they found with the J5 is that the duration of the E. coli mastitis in animals that were vaccinated versus a control was 64 hours shorter. And I mean, if you can just think that, you know, if the shorter the duration of the mastitis, the less damage to that udder and the greater the chance for that animal to actually recover. You saw the terrible photo that Dr. Inga Marie, I mean, it was quite shocking, showed of that udder with an E. coli mastitis. So an E. coli mastitis can get very nasty, and it can get very nasty very quickly. And I've had farmers that have told me, but you know, this animal was fine this morning and this afternoon she's dead. So yeah, E. coli is quite a bad one. Then what they also found was, remember what I showed you early on in the presentation, is E. coli is an environmental bacteria, and so it's an opportunist. And obviously, if you can have less infection pressure in the environment, that equates to, you know, a lesser chance of the animals actually picking it up from the environment. So what they also found with the EnviroCore J5 is that the vaccinated cows actually shed significantly less E. coli into the environment. during the 3 weeks post-challenge than your non-vaccinated animals. Okay, moving on to fortitude. So I'm just going to take you through fortitude very quickly. It's our intramammary antibiotic, like I said, and it is, you'll see on the package, it says EDC. That stands for extra dry cow. And the reason we call it extra dry cow is the fact that it actually has quite a long, it maintains effective antibiotic concentrations for quite long, for up to 7 weeks. Okay, it's a 600 milligram cloxacillin, and it is a narrow spectrum. So it is effective against sensitive gram-positive organisms. Okay, that I've said to you. Just be aware of the milk withdrawal is 35 days, and then it can only be taken for human consumption after 35 days plus 96 hours of milking out. Okay. The meat withdrawal is 28 days. All right, and then Orbicil. So just on fortitude, very, very important. So fortitude is a narrow spectrum. So when farmers are using it, or when you are advising farmers to use it, please make them aware of the fact that it's a narrow spectrum and that they should be even, they should always be hygienic when they are administering dry cow therapy, but with a narrow spectrum, even more so. All right, so Orbicil, like I said, that is our internal teat sealant that we are very excited about. In South Africa, internal teat sealants are still regarded as a relatively foreign concept. However, in overseas countries, they are using a lot of internal teat sealants, and New Zealand especially are using so much Orbicil. Well, they call it teat seal over there, but it's the same thing. And they are really seeing the effects of, decreasing the antibiotic usage and then still protecting the animals. Okay, so this is a meta-analysis that was conducted in 2013. And they wanted to study the effect of internal teat sealants on intramammary infections and clinical mastitis. So what they found was that the use of, and this is just what they found with the meta-analysis, and I'll encourage you to go and read this meta-analysis. So they took, what a meta-analysis is, for those that maybe aren't familiar with it, is they take a lot of studies and they include or exclude them based on certain criteria that they have beforehand, and they then put all the results together. And what they found was that the use of internal teat sealants, either by itself or along with an antibiotic dry cow therapy, reduced the risk of fresh cows acquiring new infections by 25% compared to animals that just received an antibiotic dry cow therapy by itself. They also use the internal teat sealant alone, and when they compared that to to animals that didn't receive anything, so not an internal teat sealant or an antibiotic, the use of internal teat sealants reduced the risk of intramammary infections by 73%. Then when they looked at clinical mastitis, here they found that it actually reduced the risk of clinical mastitis in your fresh cows by 29% when it was used either by itself or along with an antibiotic dry cow therapy, compared with animals that just received the antibiotic. And when they compared using an internal teat sealant by itself with animals that didn't receive anything, in terms of clinical mastitis, they saw a 48% reduced risk. Okay, so I think I've mentioned the keratin plug, and I think you understand the reason why it is important to actually that keratin plug forms, and how the Orbicil or the internal teat sealant actually imitates that natural keratin plug and then prevents that bacteria from entering the teat canal. Okay, so just to chat a little bit about prudent use of antibiotics. I think I have mentioned it while, in my talk, but what we see as responsible antibiotic use is using as little as possible, as much as needed, without compromising that animal's health or its welfare or its productivity. And as you all are acutely aware, is that there are increasing concerns because of the fact that there's increasing antimicrobial resistance to a lot of pathogens. And the US Center for Disease Control and Prevention has gone as far as saying that it's one of our most serious health threats internationally. So in New Zealand, the treatment of clinical mastitis cases are acceptable. However, usage of antibiotics at dry off needs to be justified. In South Africa, we're not there yet, but you never know. It might head that way. So when they identify animals that justify an antibiotic dry cow therapy, they look at what is the risk of this animal developing an intramammary infection. And for that, they then look at the clinical mastitis history on the farm records. They have a physical clinical examination, look at teeth lesions at dry off, and they look at generally at all the information that is available, somatic cell count, culturing that was done, etc. And obviously, if you take this approach, which is moving towards a more selective dry cow therapy approach, each farm will be different and each will require a different strategy. Right, so like I've also mentioned, that pathogen profile of a herd, it can differ from one season to the next, 1 year to the next. It can differ from one farm to the neighboring farm, and the same with the somatic cell count. So it's important that as veterinarians, we need to move towards a herd health management approach and not just be there to, even though doing the pregnancy diagnosis is so important, doing the calvings is so important. We need to actually develop a good relationship with that farmer and make sure that we are one of the strategic consultants on that farm, especially when it comes to things like dry cow therapy and the strategy that is going to be used. Are the treatments that we are going to use on that farm, is it appropriate and is it justified? Okay, so obviously this is the New Zealand situation, but what can be done is to look at all the available data together with the farmer so that when you make a decision, it's an informed decision and it's evidence-based decisions. And so some of the tools that you can use is your bulk somatic cell counts, individual somatic cell counts, a herd test somatic cell counts, California milk test, clinical mastitis records, and bacterial culture, to name but a few. And then some of the questions that you can ask yourself is, how long is the dry period on this farm? What is the milk withdrawal of the product that I want to use? Which pathogens are the causative pathogens in this herd? What is the risk of these animals developing new infections during the dry period in that calving? And what is the consequences if I do miss an infection? And what is the consequences on the flip side if I treat an uninfected cow? Okay, also looking at the product, is it broad or narrow spectrum, like I've mentioned before? Is it indicated for the pathogens in the herd and in the period of protection? Okay, and then I can't actually just say it enough that strict aseptic technique is so important. So I'm going to run through this. This is just to introduce you to selective dry cow therapy. Like I said, this is not really used much in South Africa at the moment. We do see that there is a gradual move towards more selective dry cow therapy, and there are some farms who are starting to implement this, and they only do so with very close consultation with their veterinarians. Their veterinarians know exactly what's going on their farm, and so the veterinarian also is so involved with up to cow level in deciding, what are we going to do for each individual animal. Okay, so if we look at what is selective dry cow therapy, it is basically the fact that, not all cows perhaps need antibiotics during the dry period. And this is a mind shift, because I think a lot of farmers feel very comfortable to give an antibiotic at during the dry period, because it's almost, the safe option in terms of, if you give the antibiotic, then, even if she doesn't really need it, there's always that in case. So what selective dry cow therapy is a bit more involved approach in terms of, you need to decide whether that cow receives an antibiotic dry cow therapy in addition to an internal teat sealant, or does she even require an antibiotic dry cow therapy, and what is the most appropriate product for that specific cow? Okay, so in the UK, they first go into a herd level assessment, then they go into a group level assessment, and then they go into an individual cow level assessment. And I'm not going to spend a lot of time on this because, like I said, this is not necessarily something that we are practicing in South Africa at the moment, but it is something to just maybe start thinking about. And at least then, if you do encounter this in the field when you are practicing one day, you know where to start, right? So it's not just, as you can see, it's not just as easy as, okay, great, we want to go, do selective dry cow therapy. It takes a tailored approach, and it takes a bit of thinking and sitting down. Okay, so you first need to assess the herd, and there is minimum information that would be required to actually, before you can even consider this herd as eligible for selective dry cow therapy. And so things like record keeping on the farm is so important, because you need those clinical mastitis records. You need individual cow bacteriology to know what pathogens are actually causing, what are the mastitis causing pathogens on that farm. Bulk somatic cell count is something that is more, accessible. But it is, once again, very important that this information is available. And if it's not available, then this herd will not be eligible to actually even be considered for selective dry cow therapy. You'll see there on the right the UK recommendation. If any of those aren't available, they say, based on herd level factors, you do not have enough information to determine the cow groups for performing selective dry cow therapy. All right. Then if you go to the group level assessment, so if they have now deemed a herd eligible for selective dry cow therapy, then they look at groups. And so then is where they start making decisions about cutoffs for somatic cell counts, to look at, which animals are going to receive which treatments. And this is determined primarily by looking at the risk of acquiring mastitis and the need for actually killing existing infections. So just a brief overview. What they would recommend there is starting at a threshold of, say, 200 cells per mole. And so you can also, this also needs to be tailored for each farm. So you can consider lowering this threshold to reduce the prevalence of your gram-positives at calving. And then that would obviously increase the number of cows that get antibiotic dry cow therapy. In your low bulk milk tank somatic cell count herds, they might consider increasing this threshold. So that would once again then reduce the risk, reduce the use of antibiotic dry cow therapy. So basically you start with, sort of a general threshold, but it needs to be adapted farm to farm. Okay. And then you go as low as individual cow somatic cell counts. And this, you also can't just go on one individual cow somatic cell count. Like you see there, a single reading gives approximately 75% sensitivity and specificity. whereas 3 consecutive readings will increase this to 95%. So it all depends on how much you actually want to risk missing an infected cow. Okay, so like I said, these levels aren't fixed. They need to be constantly adjusted. You need to be in constant communication with the farmer, and you need to reassess regularly. Okay, and then once they've decided, okay, this group is eligible, then you go down to individual cow level. And there you then look at the individual cow's risk factors, and these will include her environment. So what is the infection pressure in her environment? You look at production. Is she a high producer? You know, what are the chances of her having poor or delayed formation of that teat of that keratin plug? And then drying off. So, you know, what is her purity? What is the, once again, is she a high milk production, you know, high producer, and what is her milk production at dry off? What is the actual dry off procedure on farm? Are they doing gradual drying off by reducing that feed? What is the hygiene situation on the farm? Milk leakage following dry off, and then also, you know, obviously if she's still producing a high amount of milk, there will be high milk leakage following dry off. And then once again, that physical examination of the teat canals. Okay, and this is just sort of also a decision tree. I think Dr. Chris van Dijk would love this. But this is, you know, just a sort of a decision tree that the vets then use to decide, you know, which animals are just going to receive an orbicele and which animals are going to receive an orbicele and a broad spectrum, or an orbicele and a narrow spectrum. And that is just the basics of your selective dry cow therapy and how they instituted it in the United Kingdom, which I thought was just to share with you, just for interest's sake. If any of you would like any of the references that I referred to during the presentation, you are welcome to let me know. We can maybe just put my email address in the chat, and yeah, and then you're welcome to contact me. Okay.
Oh, Chantelle, thank you so much for your presentation. I've got a question here for you. From time to time, there's a call from the milk buyer. We found antibiotics in the milk. How do we handle such a call?
Okay, thanks, Dr. Chris. So I would advise, please contact the company that you bought the dry cow therapy, or the company that manufactures the dry cow therapy. If it is Fortitude, for example, what we would do is we would immediately then jump to action. Usually when they do these tests, these are screening tests, so they then actually, it's almost like a snap test that gives them a positive or a negative result, right? So however, the levels of antibiotics in the milk is not necessarily quantified. So how a withdrawal period is worked out is, by law, there is a maximum residue limit, and this maximum residue limit is different depending on the antibiotic active, and it is also different depending on you know, the tissue. So here we're obviously talking about milk, so there's a different maximum residue limit, or MRL, for each different active. And so that means if you've followed the withdrawal period in that milk, so in other words, you followed, for example, let's use Fortitude as an example, you followed the 35-day milk withdrawal period, and you've done the 96 hours of milking out. So how they've worked out that 35 days plus 96 is that at the end, if you've done that antibiotic levels in the milk should be below that MRL, that maximum residue limit. And that is then how they establish the milk withdrawal period. So if you've done that, if you've done the 35 days plus the 96 hours and the SNAP test comes back as positive, contact the company that manufactures that antibiotic. And so what we would do, and what we have done in the past, is we would then actually send away a milk sample to quantify the levels in that milk. Okay, so we would then, because now you have a positive or a negative result, but if you can quantify the levels to say, okay, so this is the actual level in the milk. And it's important to know that with any antibiotic, and whether it's milk or meat or whatever, if you've followed the milk or the meat withdrawal, it doesn't mean that the levels will be 0. It means the levels will be below the MRL, the legal MRL. And so, if you can quantify that limit and show that it is below the legal maximum residue limit, we are aware that some farmers have milk contracts that are more strict, and that is based on risk of the commodity. So if it depends on what are they using that milk for, in other words. So if they are using it, for example, to make baby milk powder, they are allowed to actually be more strict than the law. And so it all depends on what contract that farmer has signed with the milk buyer. And if the milk buyer requires a 0 antibiotics in the milk, then as a vet, as a private vet, I would sit with that farmer and actually then look at what are the alternatives, and what will be the most appropriate antibiotic to use in this herd. Will it be the longest acting antibiotic? Probably not. How do we implement something like an Orbisil, which is not an antibiotic, into this herd? So those are then all approaches and alternatives that you can look at. I hope that answers your question, Chris.
Yes, it's Chantelle, maybe I can just add, thank you. I was running around this morning, but I was able to catch up here a little bit later on. But I think just to add to that is maybe, just on the tests, there's several tests available. I think there's in the US about 20 different tests, call it cow side tests or tests that they do use at the plant, when it arrives there. The Delvo test, the Charm test, beta sensor test, we've got several tests in South Africa also. Very, very sensitive, as you said, Chantelle, very sensitive tests. They can pick it up at a very, very low level. But then you must look at the product, like people always ask, with a product containing ceftiofur, how can this have a 0 milk withdrawal? But the MRL for ceftiofur is 100 micrograms per milliliter, and those tests are so sensitive that they will pick it up at 2 to 5 micrograms. But then you also can get some factors that can actually, that I would like to add, that can affect and actually give you false positive outcomes. Somatic cell count is maybe one of them, especially with some of the tests like the Delvo test and the Charm test. If the cell count is below 200,000, there's no problem. But as soon as it goes above 200,000, then you start getting false positives. So especially if you're in a seasonal pattern, and there's a lot of cows calving, there will also be high levels of lactoferrin, and lactoferrin can also give you false positives. And then sometimes the milk fat and the protein, this is what's in the milk. That can also give you a false positive. So the age and the stage of lactation and the breed, and then also very important is the sampling method. The full milk, if you take that very first milk that's coming out, that may actually show you higher false positives. But I think it's important, to realize that most, if not all, the tests that's available here in South Africa, you can only use it on compounded milk, or the milk that's in the bulk tank. If you're going to use it on individual animals, you can get very, very high levels. So when you put it into the bulk tank, there's a dilution factor that we need to include there.
Yes, Dr. Chris, I didn't actually mention the fact that, these tests, these SNAP tests, are so sensitive that they can pick up trace amounts up to, sometimes 10 times lower than what the maximum residue limit is. So that is why it comes back as positive, but when you quantify actual levels in the milk, it comes back as, it's fine. It's still below the maximum residue limit. However, that then, that then depends on what is the actual contract between the milk buyer and the milk producer. Another thing that we've also noticed is that there are just some animals that just retain antibiotics in their udders for longer, and they still excrete antibiotics for a longer period of time. So what I've found when I researched this is that it has anatomical and physiological reasons to it. The mammary tissue and that dilution factor and all of that also plays a role. So that was quite interesting because animals that were treated around the same time and animals that were milked out, they followed the withdrawal period. However, if you then look at those individual animals, for some reason they just have more antibiotics in their milk than compared to their neighbor.
Yeah, there's some, I don't know, Corlia, if you want to handle the, there's some questions on pricing and so on. I don't know if you want to handle it quickly.
Yes, Chris, I can. Johanni just wants to know, what is the price of ITS?
Johanni, I would advise maybe just send me an email and then we can send you those price lists. So I will give you a ballpark figure, and it all depends obviously on the markup of of the specific vet, etc. But you're looking at around, let's say around, I would say, to be safe, 75 to 80 Rand per animal. But once again, it can be less, it can be more, depending on the markup.
And then there's just a comment from Prof. Dirk that said on antibiotics especially, due to the risk of variable calving date versus expected calving date, and antibiotics in milk after calving, it is risky to have too short dry period.
Yeah, agreed. And not just that, just the fact that that udder needs time to recover, so that you can have maximum milk production in the next lactation as well.
Okay.
Yeah, Chantelle, I think it's important there, that you must make sure then your reproduction and your records, specifically your records, if they haven't got insemination records or insemination records, then the cow can calf in the bucket, and that's not what you want. I think I would suggest to get a new herd and actually attend to a proper herd and not to people that's managing it like that.
Yeah.
Okay, and then Enrique's just said, thank you for all the valuable information. Do you have any comments on the use of a prolactin inhibitor at dry off?
I don't have any comments. I think, in my mind, the best way would be to, if possible, to reduce the feed. I don't have any experience or, with the prolactin inhibitors, so I would not be inclined to comment on that. I don't know, Dr. Chris, if you maybe want to say something there.
Chantelle, I think it's a well-known product that they do use in females, and humans, but I don't think we're using it. Maybe it's also too expensive to use it in cows. So again, proper management. If you do use RBST as an example, at the end of her lactation, physiologically, she will not produce a lot of milk, but you can get sometimes, and sometimes with these cows, it's producing 8,000 and 10,000 liters per lactation. She's still at about 20, 25 liters sometimes, at dry off. So what are you going to do with her? I think you must manage her even better, than a cow that's at 5 or 7 liters at dry off. So yeah, these prolactin inhibitors, I don't think is something that we do use in cattle, or I've never used it or saw people that's actually using. Okay, then there's a good question to use, Chantelle. I do lunch, so there's a
My journey to start working at Zoetis. Sure. I don't know. Do you want my life story? I don't. I don't know exactly what you're asking. But maybe I think the question is, and I get it a lot from a lot of people in terms of, you know, why would you choose to be a vet working in industry compared to a private veterinarian? And what I found is I think a lot of people see private practice as basically that is, you know, the only way to go, or the ultimate way to go. And I think when we start studying veterinary science, that is what we all have in mind, right? Is private practice. And I don't think we always realize as students when we start studying how broad veterinary science actually is. And I can say that I've worked in private practice. I've worked for state. I was a state vet in you know, provincial state vet, and then I was also a state vet at the national office where I worked with imports and exports. And now I work for Zoetis, and I'm so grateful for my journey, as you put it, in terms of that I had literally gotten exposure to almost every sphere of veterinary science. We have a lot of veterinarians working in our abattoirs with food security. And so I think, you know, I think our private practice veterinarians work very, very hard, and I take my hat off to them. But I don't think we should disregard what the other spheres of veterinary science can actually mean to things like agriculture. And that is why I absolutely love my job, because I feel like I can make a bigger difference in terms of not just, we have a lot of interactions with students, but then we also have a lot of interactions with veterinarians. We have a lot of private veterinarians. We have a lot of interaction with farmers. And so, you know, I'm always joking in that I either work in high heels or in fallies. So I really feel like it's best of both worlds in terms of having, you know, the opportunity to interact with farmers across the country, not just in one area, and getting to know so many people and getting to know so many farmers across the country, I think, and feeling like, you know, we can actually make a contribution to agriculture in general is what I absolutely love about my job. So I hope I've answered that question.
Chantelle, maybe I can also add, you know, I spent 18 years in private practice, and then during that time I did my MED vet. Then I got to a stage, you know, where I was actually approached by the company, you know, and they said, "Are you not interested?" And then, yeah, I said, "Yes, I'm interested." It was a completely new world to me. You know, when I qualified, I was standing under the shower after, or in my final year after rugby practice, and somebody said to me, you know, they heard there's somebody that wants a vet up in the Highveld. So that's where I started. You know, I didn't even look at what I wanted to do. But yeah, it's a journey. You know, I think in the end is the exposure in the corporate world. It's exposure to the corporate side of things. It's worldwide. I think Zoetis has got how many people? 4,000, or I don't know how many you've got there. People working for Zoetis is, you know, it's a global company. And then exposure then, you know, I started as a technical manager then in Pfizer, then technical and then marketing. And then after that, regulatory and business development. So I've done everything there. I see Dion van Wyk is still on the line here. So I've put a lot of things into the pipeline. This fortitude that you mentioned, you know, I started with the original work, and it's good to see, you know, something that's actually on the market now. So development of products, you can become involved in that if that's your interest. So yes, I thought when they ask about the journey as traveling to Johannesburg and back, that's not very good, you know, to do that.
Yeah.
But yeah, the journey in the company is very good. I've been all over the world and exposed to everything. And I think it actually equipped me, for what I'm doing now. So I always said I was standing next to the cows and behind the cows. I decided what to put into the cows, and now I'm working with the owners of the cows. So yeah, it's a 360 that I've done, but it was a good journey, and I'm not finished yet.